Hey, but it's real life. When we talk about misery loves company, it's just because we do like to connect when we're struggling.
I think that's important too, being supported in things that they do or don't want to experience, depending on how it's going to affect them. Why put yourself in a situation where you're not going to be happy? This is Rhea, and this is Just the Who of Us, where we talk about a range of topics, including life events, current events, spirituality, entertainment, family relationships, as well as answering listener questions and more. Today, I am excited to introduce what is your first language and where are you from generally?
Yeah, so I'm originally from Austria, and so my first language is German, but I've been here several decades now, and I'm comfortable with the language and the culture and whatnot, but there's just always a little bit these little leftovers that hang around. So yeah, but that's where I'm originally from.
Nice, nice. Okay. Kind of tell me a little bit about yourself, about who you are professionally.
Yeah. So I'm a licensed clinical psychologist and I am in the state of California. So I have a thriving private practice here and recently, a few months ago, developed an app for therapeutic coaching because some people want to be more immersed in their personal growth with individual therapy or even family therapy. I tend to see people once a week or even every other week. And with an app, you have access every day to some personal growth material and can be more focused on yourself for a few months and really be in it. But those are the things I do. So personal therapy, family therapy, therapeutic coaching, just joining people on their journey of personal growth, recovery, healing from trauma, from healing through grief, all of that.
Yeah, yeah, that's
Yeah.
amazing. That's amazing. And that's kind of like how we connected and why it's really important for me personally to have you on in December because there's a lot of, while a lot of us are celebrating, there's a lot of us who are simultaneously going through grief or still working through traumas and things like that. And it's kind of this, I absolutely love the holidays. I love everything about it.
Mhm.
And I've always kind of tried to focus on that and leave my grieving for the other 8, 9 months of the year, kind of thing,
Right,
which is
right.
isn't really realistic. But it's one of those things. I'm like, okay, well, I want to enjoy the holidays. I have kids, I have family, I have two pretty big families, and like I just want to enjoy all the things. We love going riding around looking at Christmas lights and baking the Christmas stuff and the Christmas movies and all of it. So it's like,
Hmm.
okay, well, let's just do all the other sad stuff the rest of the year. And then, you know,
Okay.
however, because I know other people do the same thing, and there's someone in my life who is really doing the opposite. So it's kind of like we both could use some more successful strategizing in, how we grieve because masking it and putting it aside, but also not participating in anything and just kind of going into it. They're both not the healthiest options. And so I know
Right.
that there are other people who experience, the same kind of two extremes. And so I'm really glad that you're here for, this kind of time for this month because I know there are a lot of people who are going through this, similar stuff, could really, really use to hear what you have to say, your wisdom and your education and everything that could really be helpful for a lot of people during this time. So thank you for being here.
Yes, and thank you for having me. I think it's fantastic, these platforms and you making room for these kinds of topics. Really anything mental health and grieving is part of that. In modern society, we have a tendency of disconnecting from each other instead of connecting and joining each other in that.
Yeah.
So, right, these platforms and the way you're approaching it is one of the lovely ways that we can actually be in it together.
Well, thank you. I appreciate that. Let me ask you before we kind of get into a little deeper, why did you choose this career path? And with trauma, why did you choose that niche in coaching? And kind of how do they go together?
Sure. Quite honestly, when I first chose this field, I didn't yet know what it was going to be like. It was more of a decision of what can I see myself doing as a passion and as a purpose in life.
Yeah.
How can I have my career coincide with who I am? And so it sounded warm and fuzzy to support people and to be there for them. And then what I really learned through the process is that I needed to do my own work. That
Ah,
I
same.
that I had to really dig in and see what was still left over for me and where I maybe wasn't my most authentic version, where I wasn't yet in the types of relationships that were the healthiest and really all of that. And then through that also learning how to really authentically support other people, recognizing that this journey is messy, it is complicated. We're all doing the very best that we can. And in that, it just became something a bit different than what I anticipated, but just also something really lovely.
Yeah.
And trauma, and as we're talking about grief today, trauma and grief are just human experiences that we all tend to have at one point or another. So again, if I can be there for people and support them in that journey, and be in it really again together. I'm not a blank slate. I'm a human being, I've gone through my own things. And so we show up in the room and we work it out together.
Nice, nice. I love that. I used to be a really big, just kind of suck it up and get over it. Like that
Mm,
was kind of like my life
sure.
motto
Yeah.
to an
Well, we're
extent.
groomed to do a lot of ways. Yeah.
Yeah, and then even so I had my first child a month shy of 15. So this 14-year-old, 15, 16-year-old girl, that's what I taught my first child. And there are certain things that I can see still that the things that I've instilled incorrectly within him as a small child, he's older now. And so there's certain things that we have been working through and having the education and the knowledge and the life experience I have now, I'm definitely not that kind of person. I still have with myself have to be like, okay, like you can cry, like it's okay. Don't want to yell at yourself because you're getting emotional. And
Mhm.
so like I said, as a person, like I did that for a long time. Why do you think that it's such a thing in specifically American society to just be like that? Like everybody goes through stuff, just suck it up and get over it because it is a
Yeah.
common thing.
Well, in a way, it protects us from pain. If we
Mhm.
disconnect from our emotions or from other people's emotions, then we don't really have to feel them, or at least that's what we're aiming for. If you think about our system, our brain and our nervous system, it's made to keep us safe. It's made to put us into a state where we feel like we're in control. And when we feel big feelings or we watch other people have big feelings, that doesn't feel like control. That can feel overwhelming. And we like to protect ourselves from that. That's a human tendency to go in that direction. And I think societally we've gone a bit too far with that, disconnecting from it and then not tending to ourselves in the way we really deserve and also leaving other people feeling somewhat isolated in a way. I think it's why support groups are now so needed, because
Yeah.
oftentimes we have to go to a support group or to therapy to find that belonging and that platform where we can connect because out in the world, we're often taught to keep it to ourselves, or
Yeah.
we even can disconnect from others as well. It's like, oh, those big emotions feel really scary and they feel really big.
Yeah, absolutely. And I've noticed within myself, once I kind of did as an adult start allowing myself to feel emotions, I almost became kind of like overly emotional with that.
Mhm. Okay.
At least it felt, kind of like, yeah, like overly. I'm like, oh man, I feel everything now, and I'm not used to this, you know?
But you kind of making a point there when you said at least it felt like you
Right.
were going too far, right? There's this to compare it to something silly, if an introvert is practicing and speaking up a little more, once they do, all of a sudden they can feel like, oh no, I'm taking up all the space in the room. I'm being too big in the room, which is not actually what's happening. It
Right.
just feels new and different and foreign. And when something feels new and different, we tend to label it as wrong. Now I'm doing the wrong thing.
Right.
So when you started feeling your feelings, that probably felt a little wrong.
Yeah. Like, no, 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 wait, we're not used to doing this. Is this the
Sure.
yeah. Yeah, absolutely. Absolutely. So what led you to getting into grief and trauma coaching from having your established practice?
The coaching piece really was that my practice is always full. I can only see so many people, and still wanting to be able to offer my knowledge in the package of who I am. And that is something that individually I just can't offer so many hours during the week.
Yeah.
So that's why I decided to do the therapeutic coaching. And again, once I really started conceptualizing what that would look like, I got excited that, oh, I could do something where people work on themselves 20 to 30 minutes a day for about 5 days out of the week, right? We all want a little bit of a break. And then doing that for 3 months so that you really are shining the light on yourself for many weeks. In a way, if you think about when we're parenting our children, how much effort that takes, how much focus that takes.
Yes.
We tend to not really do that for ourselves. We just go on autopilot. We can be in survival mode,
Mhm.
flow through life like that, but often not really necessarily taking care of ourselves the way we really deserve,
Right.
not noticing maybe when it's time to make an adjustment, or when maybe I need to tighten my boundaries a little bit, or when an outdated message is running the show that my parents or maybe a previous partner gave to me, those types of things. And so working on ourselves every day a little bit, that concept really got quite exciting to me to make that available to people. Yeah.
Yeah. So when you were kind of in your beginning of your career, did you have, I feel like I probably already knew the answer to the question, but I think it's a good question to ask. Did you have your own kind of mentor or go-to person, whether it be someone already in the field established or just someone you kind of met along the way in the beginning of your career? And how did they play a part in your kind of growth?
Yeah, absolutely. And I still do, quite honestly. I think we always need some people that are unbiased or that are outside of ourselves. But at the beginning, I was really lucky in my internship placement. I got to do my internship, my hours in this private practice with an amazingly established clinician.
Oh,
And we didn't always see eye to eye on a personal level,
hmm.
but when it came to how she did therapy and her commitment to that and her knowledge and her guidance through that was huge. And then you meet people in the field once you're in it, and you connect with others who you look up to, or who you go, wow, I really like them as a human.
Hmm.
And I also would love to know what it's like to be in the room as a client in a way. And then seeking consultation along the way. I still do that now. When
Yes.
something comes up and when I'm not quite sure if my own stuff is getting in the way, or why something maybe is feeling so big for me in the room with someone.
Hmm.
Um, I think having mentors, having others, that's always important.
Yeah, that's one thing I learned when I was in college for psychology specifically was to never stop learning from people. Never stop at any point in your mental health career, never stop asking questions, never stop learning new things. And like you were saying with like kind of outdated practices, never stop learning new things, never stop learning from people in the field and things like that. It's very important to constantly have someone to learn and grow from.
Absolutely. And even now, when I do some reading, I can read an entire book in the field of psychology and maybe only get one or two really super new nuggets out of that. But those one or two nuggets
Yeah.
somehow shift certain things or certain perspectives that I had before. So I think it's always important to stay open to that.
Yeah, I agree. How do you, within your practice, because this is something that's kind of, not kind of, it's very important too when you are guiding other people in a professional capacity. How do you keep your personal life and thoughts and feelings separate from your professional thoughts and feelings? And
Well, I don't really think I entirely keep it separate, but for me, it's an extension of conscious living, being
mhm,
conscious, being aware of what is impacting me from work at home and from at home at work.
mhm,
And in a way, even there, working with it. So it's not so much keeping it separate, it's just more of keeping the awareness and being able to step back a little bit, have a bit of an observing self is to be aware of myself and being aware of what's going on. And then in a way I can work with it. And of course, with that, working with that vicarious trauma that can happen,
uh-huh,
right? That's part of that awareness. I have to be aware of what's impacting me. I have to be aware if something really hit hard or if a person's suffering is bringing up something in me that is hard to separate. I don't necessarily work harder at separating it. I
mhm,
just almost put more attention there in my own continued work and what's going on there so that I can be again aware of it, conscious of it, work with it. I never really work on being less human.
yeah,
If anything, I want to continue being just as human as I've ever been and always will be. But again, with empathy and with vicarious trauma, just being aware that I don't need to bleed out and I don't need to feel the other person's feelings entirely. I don't need to absorb that in order to have full empathy, in order to experience their human experience fully. So it's a bit of a tweak rather than stepping back fully, if that makes sense.
yeah, no, that makes complete sense. Bringing up the kind of vicarious trauma that's interesting to me too, because specifically say when you're working with grief, my fiance, we lost his mom 4 years ago, like right at Thanksgiving. And so for him, it's kind of right before Thanksgiving to right after Christmas is super difficult. And he's not in mental health, but say if he were, and he's going through this over the holidays, there has to be, this kind of line to where, you're like you were saying, like he can't somehow harm someone, a patient,
Hmm.
through his grief. There has to be kind of a balance to where he can still help his patients not hurt himself by overexerting himself, but also not harm them through his. I don't know if that's the best example, but you
No,
get
I
what
absolutely understand. Absolutely. And so in a way, the way I framed it for myself very consciously, when I was going through my own loss, is that I saw my time with my clients as a mindfulness practice.
hmm
So when I was in the room, and I still do that, when I'm in the room with a client, I'm in the room with that client. And in a way, then fully appreciating that person and that experience and that hour. And my stuff is still not fully off to the side, but I'm mindfully present with what's going on in this hour and with the person that I'm sharing this hour with. And that to me was a really powerful shift, again, when I was going through my own intense grief.
hmm
So that I wasn't asking myself to suppress it, but when I am with you in the room, you do get my attention, and I can then be fully present while I still have my things going on in life, but they're not, those things aren't running the show in that moment.
Right. Right. And like you said, kind of having those mentors too, having people to go
Mhm.
to and kind of check yourself. My emotions are kind of getting in the way of this, how I just want to make sure that I'm still listening clearly. I'm still, it's important to have those go-to people because as a professional, you need just as much support as your clients do. Realistically, you're grieving, they're grieving, you know, to be able to heal someone else, you have to be able to take care of yourself too. So I think that's a very good point that you made on that.
Yes, and particularly during acute grief, I made sure that I had my own therapy too, so that I knew that my own grief had a place to breathe, that there was going to be a place for it, that there
Yeah.
was going to be full focus for that. And that helps as well to then be able to be mindful with other people's journey.
Mhm. What has been kind of, or has there been a client that you've had that has been difficult for you emotionally, specifically dealing with grief?
Sure. There are certainly things that hit even closer to home than other things. So anything that mirrors my journey very closely, I then have to do my own work around that more. My son died when he was 18 years old of an accidental overdose.
Mm,
So when I work with someone who has a very similar experience, maybe they lost their child, or if it gets very similar, someone who's lost a young adult son, maybe to very similar circumstances, then my feelings are bigger.
yeah,
What shows up for me in the room is bigger. But since it doesn't really take over in a way, it just becomes bigger. I've really found that it has a huge connecting feeling in the room
that's a good
that
point.
at the
Yeah.
end of the day, we're still living this human journey together.
Yeah, yeah. I like that. That's really sweet. Yeah, like it kind of instead of kind of creating this little like kind of jealousy or, aggression, it's kind of like, hey, like I can relate to you and it's kind of a like a little bonding
Hmm.
rather than
And
upsetting
sometimes
feeling.
Sometimes that doesn't even have to happen in words, particularly. I
Yeah,
think we know when someone's leaning in. We know when someone's heart's opening up. We know when there is this connection, and that just shows up.
yeah, yeah. It's so funny how life experience and healing can play such a part in what you're kind of able to do, what you're kind of able to put out into the world. Because for me, were you already practicing when you lost your son?
Yes.
You were. For me, the things that I've kind of worked through I didn't really hit a kind of like a peak in healing until I went to school, until I started my education for psychology that taught me so many tools that I know it's like nobody wants to spend thousands and thousands of dollars on an education just to heal from something. However, that education for me was more about than just a career. It really was about my own kind of personal journey. And I'm glad that I went through it as I was getting the education because I feel like the knowledge is so much more beneficial for me and for the people that I share it with now because not only did I learn it, I kind of like experienced it as I was learning. And that was, like I said, like I don't suggest everybody go spend that much money. But for me, I'm glad that I did that when I did because I feel like had I gotten that education maybe before, I learned any kind of healing or before I realized that I needed to heal from things, I don't know if it would have really meant the same. Yeah, does that make
Mm.
sense?
Well, and who knows? But the truth is, you end up applying it no matter what.
True.
You
Yes.
end up applying that, and that is why it circles back down to the therapeutic coaching. I mean, I made that 12 weeks with different topics because I want everyone to have this knowledge that I have.
Hmm.
Um, I certainly get to take care of myself in a different way because I know about nervous system regulation and self-parenting and grief and how to take care of ourselves through that and attachment style and
Yeah.
boundaries. And these are just a few examples, but I feel so grateful that I do know these concepts and that I do have a certain awareness of how to work with it. And it's a life changer when you have that knowledge and when you can apply it consistently.
Yeah, absolutely, 100%. Absolutely. My oldest daughter, she's currently in college for psychology, and I'm proud. Like I would have been proud for anything she went to school for, but it's just kind of like, oh, it's like it's extra special because it's like she has certain things to work through at some point. And we all do, really, no matter how big or small the things may seem to one person, we literally all do. We're all living life, even if it's just COVID, even if it's just this or just that, like we all have something to work through. And I think that's important to understand too, that, I mean, it's easy to say kind of like, oh, well, like your only problem is blah, blah, blah. But to that person, especially if it's their only thing, like that's a massive thing, probably, like
Mhm.
it's so, I've never met anybody who didn't have something, no matter how big or small it was to them. But I'm proud of her for that because it's like, oh, you're kind of like continuing, the little work.
Yeah, that's amazing. I love that.
Yeah, yeah. So let's kind of dig into holiday grief. Holiday grief specifically. Not to say obviously that if you're grieving any other time of the year that it's less important because it's not. It's not. For me, this is something that I am choosing to focus on this whole month and maybe a little bit into January because it just does seem to be a rougher time for people, and I
Mhm.
think it is because we're trying to place ourselves in two different places. Specifically for parents, we have kids we're trying to, we want to make sure that they're good. We want to make sure that they're happy and enjoying things. And while we're just kind of experiencing certain things or not, tabling it, whatever the case may be, um, so it's no less important when the holidays aren't here. It's just a little more distracting when the holidays are here.
Mhm.
How would you suggest, and I know too, kind of everybody's different, so it's easy to kind of give these generalized kind of bullet points. And for some people, there may be necessary modifications. But for just kind of general advice, how would you suggest trying to kind of balance all the things that you want to dive into with all the things that are still so prevalent in your head that you're trying to work through while you're trying to kind of people please and self please and enjoy
Mhm.
and experience and all the things kind of going through these both at the same time.
Right. Well, the holidays and certain anniversaries,
Hmm.
they are harder. We know they're harder
Yeah,
for people who are grieving. There's something about when we talk about trauma and that we hold trauma on a physiological level. Well, grief is trauma. Grief does shatter people's
absolutely.
worlds.
Yeah.
And now we hold on this physiological level, and our body and the rest of our system then reacts even more strongly during certain times of years, during certain anniversaries, and the holidays is part of that. So during the holidays,
Yeah.
the level of pain tends to go up. And like you're saying, then on top of that, there's certain expectations or pressures to feel like we have to tend to as well. So that's a pretty big double whammy for people.
Yeah.
So I always keep it front and center of, am I making it worse? Am I increasing my suffering? Or am I doing what I can to tend to it? And that then for me goes through that lens consistently, and I can apply that to whatever is going on. So, am I making it worse by leaning into certain expectations, or does that actually help me? Am
Right.
I making it worse by being rigid about what I think should be happening during the holidays? or does it help me to have certain traditions and structures? So you're right, it's so different from person to person, but if we can ask ourselves individually, am I making my suffering worse,
Right.
or am I tending to it? And then that can change how I tend to my boundaries. It can change to how I tend to traditions. It can change what I'm able to do energetically, how much energy I'm able to invest in certain things.
That's a good point too.
Shows up in all kinds of areas then.
Yeah, so there was an event coming up, a holiday, related event, and my fiance, he's like, well, I just don't think I'm gonna go. I think I'm kind of burned out. And my, initial response wanted to be like, well, why? You should go, you should have fun, you should be involved in things, and blah, 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 blah. But when I actually thought before I spoke, I was like, you know what? If you think that's what's best for you, then I support you. I think that's important too, being supportive in things that they do or don't want to experience, depending on how it's going to affect them. I can be supportive of him and say, hey, they would love to see you if you're up for it. But if you're not up for it, why put yourself in a situation where you're not going to be happy? Does this situation remind you more of what you're grieving about? Is this going to make it harder for you emotionally? And if not, then you probably should, just maybe stay home with him, or maybe go, because he's insistent. No, go and enjoy things. And I kind of gauge it off how he's feeling. If I feel like he's in a kind of depressed mood and things like that, then I might stay, just be supportive of him. If I genuinely feel like he's like, no, I'm okay. I just don't know that I just don't want to go. And that's okay, then I might still go. I'm probably gonna check in on him, kind of thing. But it's those kind of things too, like gauging activity. Because he has gone to some things, and he's just like, he's also a less social person than me. I'm a very, very social. So, like being in my room for 5 days with COVID was, I'm telling you, if I wouldn't have had another COVID buddy, I I might have gone crazy. Like, I don't know. I'm calling people on the phone or something. I need to talk to somebody because, but he's not like that. And so when someone is grieving, you kind of have to respect their feelings and their wants, not to where I'm gonna leave them peace, obviously depressed and things like that, not showering and whatnot. But if he's taking care of himself, then it's okay. I'll check on you, whatnot. I'm not gonna force you to have fun like I want to try to do just because I want you to be happy, But sometimes us forcing them to try to be happy doesn't make them happy because they're grieving.
Sure,
you know.
and sometimes happy is not on the table
Yeah,
at
yeah,
that. And
yeah.
so then really again honoring what is going on. Part of empathy is sensing what people are going through, sensing what they're feeling. And that's not the same as this expectation that I'm supposed to mind read what someone
Right.
needs or what someone is feeling. But if I know someone well, or even if I don't, I can attempt to sense and match the energy in the room, the energy of what's going on.
Yeah.
Have empathy for that, and then be flexible. I know for myself, I had to be so flexible, even more so during the acute stages, but even now,
Hmm.
things can change on a dime. I can make plans and think I'm up for it because I'm having a lesser grief day.
Yeah.
And and then the next day it looks completely different and I am not up for it. So
Right.
that flexibility with myself, to being willing to adjust when my energy level has changed, when my grief is heavier certain days than others. Um, and I'm always so grateful when my loved ones are flexible with me, when we've made plans and I wake up and it would just be such a I'd have to dig so deep to make it happen to then have the support that I don't have to. It
Yeah.
makes a huge difference.
How long and at what point do, with someone that you care about, do you just kind of leave them to grieve? Because there becomes a point where it becomes unhealthy potentially with certain things. And So how do you personally kind of decide that factor when it's a little more than just grief and it's kind of necessary to step in a little bit, even if it may be comforting words or suggestions or things like that.
Even there, I think it just so depends on the relationship and also on one's own stuff. If I
Right, right.
have a
Yeah.
history of people pleasing, if I have a history of taking others' emotional pulse and being hyper vigilant about what they're feeling, then knowing that about myself and knowing when maybe I'm stepping in too much and trying to support someone in their grieving,
Yeah.
um, then trusting what they tell me. If they say, hey, I just need this day for myself, or I'm okay at home, you go do what it is that you are going to do. Um, Again, the combination of sensing of what are they feeling,
Yeah.
also knowing my own stuff of not becoming codependent, knowing their love language. Do they generally prefer to have someone close
Mm,
and have affection and have them present, or does someone really also prefer to have some of their own space to
yeah.
process? I
Yeah.
think it's a bit of a dance in our relationships to really work on it together.
Hmm.
It's not like I by myself can fully figure out what the other person needs or wants.
Right, right.
And the
Yeah,
other person
that's a
can't
good point.
necessarily fully figure out what they need and want, especially if they are in a full grief ambush. They
Yeah.
may need my help in figuring that out. So it becomes a bit of a dance.
Yeah, yeah, I think those are really good points. I think, and it really is an individual thing too. One of my goals for this month and having certain people on to talk about certain things is to not only help listeners that are grieving themselves, but people like myself and others who have family members who are grieving because
Mhm.
it's difficult sometimes to apply things to other people if you haven't experienced it yourself. So that's yeah, like one of my goals, hopefully, is that if someone say isn't grieving themselves, but they know someone who is, either way, there's helpful things to get you through either part of that grief,
Yeah.
the
And,
experience
and
or the
certain,
support.
yeah, and certain things we know disconnect us from each other and from
Mhm.
the person who's grieving. We know platitudes make things worse. And again, we offer platitudes because we think it fixes things for people. Saying things such as your loved one's in a better place or your loved one wouldn't want you to be sad. Even
Yeah,
if there's some truth in those words, that truth doesn't take away from the pain the person is in. So I would say kind of watching one's tendency. And I'm not saying that there's anything wrong with it in a way, because again, it's a human thing of I want to make you feel better.
right, right.
But also knowing that it tends to backfire. And so working on withholding those platitudes and instead validating their experience, validating how hard it is, or even more than hard, how devastating it can be. Sometimes we have a tendency of judging people, thinking, oh, if you would have just done something different, or if you would tend to your grief differently, it wouldn't be like this. Sometimes we other people, saying, well, that happens to other people. So
Yeah.
platitudes, judging, and othering, those are three big things that I put in the category of it disconnects us from the grieving person.
Mm, that's a good
Um,
point.
but we can do things to connect. And for that, like you were asking, how do I connect? I may need to ask them, how do how do you like to connect? Do
That's
you
a really
like me
good
to just sit on the couch with you and just be? Do you want to talk about it? Do you love it when I mention their name and when we reminisce together, or when I allow you to reminisce? Do you prefer not to do that? We get to explore that together.
That yeah, I love that. That's a those are really, really, really good points. I think it's sometimes it's difficult when you want to help someone to not just act, you know,
Hmm.
and sometimes we don't. We're just kind of like, okay, I just want you to feel better, and so I'm gonna do these things and these things, and it's not always helpful. And they usually know that you have good intentions. But if you really want to be helpful, I that's communicating with them is the like probably the best advice that I've heard. Even with my older kids, they're my kids, so I'm pretty familiar with them. I know the things they do and don't like. And my older kids, they're not very touchy. They'll come up and like if I'm not feeling well or something, or if it's like my birthday, they'll give me a big hug, because they know I love it. But I don't just and I had to learn this, not to just like coddle if they're going through something, because I, as mom, want to go up and just like hug you. And sometimes I just need to listen to you and visually, be standing there and know that I'm acknowledging you and supporting you. Even if I want to hug you, I know that's not what you want. And so it's important to support people the way they want to be supported. Because if you're not, then it's not really as helpful. Acknowledging that you're there, that you're willing to try to be helpful is helpful, and accept what their wants and needs are if they are the one grieving and you're trying to help. That's the best advice that I've heard.
My partner and I really had to talk a lot about these types of things and still have to.
Yeah.
He's struggling and I can see his grief is surfacing,
Mhm.
then he doesn't want me in that moment to name it. He
Right.
doesn't want me to say, "Oh, it seems you're struggling more today. What's going on?" For him, he says, that brings it up even further, and he wants to rather just be supported with affection and me doing things for him that day so that he doesn't have to those types of things. Whereas when I'm grieving heavily, I used to get frustrated. I'm like, why do you not acknowledge? Why do you not name it? Why do you not speak to what you're obviously looking at?
Yeah.
And he was concerned it would make it worse for me. And so again, having to learn that for me, when I get to allow my tears to just do its thing, and when I get to show my emotions that are already happening under the surface, but now I get to share them with you,
Yeah.
that for me, that's helpful. So we really had to talk about these differences. Otherwise, we would have given each other exactly the quote unquote wrong thing just because we're different humans and we need different things to feel loved and cared for.
Yeah, absolutely, absolutely. It's you and your partner sound a lot like me and mine. He's very much like that. And I had to learn that too with the grief process with my mother-in-law, that most of the time if I just randomly bring things up, could make it difficult for him. However, if he wants to randomly bring things up, that means that he's in a place where he can do that, and it's just for me to just listen, whether it be pictures or memories, or because it is kind of, for someone who is on the outside looking in and someone who grieves different, it might be easy to say, okay, well, when I do this, you don't like it, but then you do it and you're not upset. And that's okay. It's like, it's a thing that
Mhm.
you have to explore and learn. And for me, it was kind of like that. I wasn't like that. Like, why is that okay for you? But I did notice in the beginning, it made him uncomfortable. I wanted to put out pictures to remember her. I have this kind of, I'm really into the Dia de los Muertos, and I have this kind of shrine on my mantle. It's got pictures of our deceased relatives. So I wanted to put her up there. And he was kind of like, I can't, that's not comfortable for me. And like my grandparents is one thing, but like I'm not comfortable with that. And although I really wanted to do that, because for me it was a way to honor her, it was like, oh, okay, it's your mom, and this is not comfortable for you. And if it's not comfortable for you, then I need to wait. Now we have her up there now, but that's because he's comfortable with it now. Like he can look at pictures now, and it's not as painful. So I think that's important to understand too, as someone, as the grief supporter, that even though we might want to do things a certain way because it's helpful to us, it's kind of more about focusing on the person who's grieving now, without completely neglecting ourselves, because our grief is
Mhm.
important too. But there has to be kind of a common ground of, okay, what can I be comfortable with that's most helpful for them?
Right. And in general, whenever we get a little nervous about codependency, I think the big question is there a reciprocal flow?
Right.
Codependency tends to be one person does the caretaking and one person ends up being the receiver. And when that's the consistent dynamic, then we're certainly in the codependent situation.
Hmm.
I always talk about the importance of interdependence. So
Hmm.
we don't need to be completely independent. We also need to
Right.
be careful of codependency, and interdependency really means there's a flow. Overall, the relationship is pretty reciprocal. During times of grief, that balance is naturally going to change, and the
Right.
grieving person is going to need more. But if I'm with a person over decades, it's okay that how it is reciprocal will shift through certain phases of life.
Yeah.
As
Yeah.
long as overall it has a reciprocal feel to it.
Right. I agree. I thought that's a good point too. It can't become where because you do have to still take care of yourself, you know.
Mhm.
It can't become where you're pouring everything out and then you're just empty. How do you take care of yourself? How do you take care of the kids? How do you really even take care of your partner if you have nothing left?
Mhm.
We still have to figure out how to take care of ourselves professionally and even personally, even outside of professionally. You know, we talk about professionally, we need to keep that balance and have a mentor, have a therapist we see, and things like that too. But even personally, even if you're not a professional in the mental health field and you have someone who you're trying to support through their grief, that still applies to you, even if it's not your profession. You know, it still applies to the individual on a personal level because, again, you can't pour out into others if you have nothing left within yourself because you're pouring it all out and not refilling it.
Yeah, sometimes I use the difference between compromise and sacrifice here. For me, there's always room to compromise within really any
Absolutely.
relationships.
Yeah.
If it feels like I'm sacrificing my well-being, then I need to look at that, and I probably need to do some work around my own boundaries. But those two things feel very different to me. Compromise still feels lovely in a way. It feels like I'm
Yeah.
giving, it feels like I'm contributing. Once I start to feel like I'm sacrificing, I start to feel resentful and drained and just starting to feel like we go on empty. So knowing the difference between those things can help.
And give me your best piece of holiday grief advice before we kind of wrap up.
The thing that comes up for me when you say that, because the grief is so heavy during the holidays, is bargaining is such a normal part of grief.
Oh, I'm
But
glad you brought that up.
yeah, I want to put in there though too that even though it's a normal part of grief, if we identify when it's happening for what it is, then we can do it to that level of that it's just going to be part of grief, but not necessarily getting lost in the bargaining process. Because when I said earlier, do we make our own suffering worse or are we tending to it? When we get lost in bargaining, we start to make our suffering worse.
Yes. Yeah.
We just keep going with I could have, I should have, if I would have gone left here instead of right here, if I would have made this decision instead of that decision, if I would have been there, if I would have driven that day, if I would have changed the schedule, if right on and on and on and
Yeah.
on. And
Yeah.
again, doing that for some moments is totally normal, but getting lost in it
Yeah.
increases our suffering. And to be really honest with oneself, when I am bargaining, I am telling my fantasy. So if I say, well, with my son, if I would have made this decision and not that decision, everything would have worked out okay. But that's my fantasy. And in my fantasy, I'm filling in what would have happened if I would have gone left and not right. And if I would have gone left in my bargaining fantasy, it doesn't have any of that stuff. It
Right.
doesn't have any other barriers that come along. It doesn't have any other pitfalls that maybe would have shown up if I had turned left, because I don't know what would have happened there. So being really honest with self that when I'm bargaining, it is my fantasy. I am filling it in a way where it wouldn't have had any further pitfalls or any further tragedies.
Yeah.
And then knowing that that's not really realistic
Right.
and makes our suffering so much worse, because then we say, if I would have had this fantasy, everything would have been great. And that's just not really the truth of things.
Yeah. Absolutely. I think that's fantastic. Where can we find you if you have a
Yeah.
website?
So when you look up Authentic Wisdom Warriors, even just Googling that, it's the only website like that. It'll come up, Authentic Wisdom Warriors by Dr. Iris. And my website has all my social media links and on a banner in the bottom. It is all Authentic Wisdom Warriors variations. So it can be easiest to just go to the website and to the links from there. It all has the breadcrumbs there.
Perfect, perfect. Well,
Yeah.
I really like. I feel like I could just talk to you for hours, but I really, really appreciate you being on here, and hopefully we can talk again soon. I really enjoy your conversation, and you have a lot of helpful tips and things to share. I'm glad that we stumbled upon each other, and I'm really glad to have you here. Thank you so much for being a guest.
No, thank you so much for having me. And again, to you, your audience, myself, let's be good to oneself and to others. Let's honor our journey and let's work on not making the suffering worse.
Absolutely, absolutely.
Really nice to be here. Thank you so much.
You're welcome. Thanks for being here. All right,
Bye.
bye. If anybody has questions they want us to answer or topics to discuss, you can leave that on the Facebook page. Visit www.philolity.net. That's FALOLITY, where you can purchase your own copy of Surviving Mom Brain and Dad Brain workbooks, as well as my autobiography.
Adios, mi amigo.